Okay, so as I said, Trump has also tonight announced a number of key administration picks who may be working under the authority of his pick for HHS Secretary Robert F. Kennedy Jr. For the Commissioner of the Food and Drug Administration, Trump has chosen Dr. Marty Makary, a pancreatic surgeon at Johns Hopkins University, who previously said that the federal government was the greatest perpetrator of misinformation during the COVID-19 pandemic. Makary is a proponent of natural immunity, saying it was at least as effective or even better than immunity provided by vaccines. And Makary mistakenly argued that the U.S. would reach herd immunity from COVID by April of 2021. For the director of the Centers for Disease Control, Trump has picked former Florida Congressman Dr. Dave Weldon, a trained physician and Army veteran who served in Congress from 1995 to 2009. And for U.S. Surgeon General, Trump has tapped another Fox News contributor, Dr. Janette Nesheiwat. Joining me now is Dr. Vin Gupta, who is an MSNBC medical contributor. Dr. Gupta, what a night it is turning out to be. Let's just go through these names here. Admittedly, this happened moments ago, so I'm just looking for an initial reaction here. Surgeon General Dr. Janette Nesheiwat, she is a Fox News contributor, which seems to be the must-have on your resume if you want an appointment in the Trump White House. What's your initial reaction to that?
I didn't know her by reputation, and I've seen some of her clips. She's actually pretty modest and I'd say plays pretty conservative when it comes to saying things, Alex, that we may disagree with. And so on that pick, I would say that's probably the most sober pick that we've seen when it comes to President-elect Trump's health appointees. I'd say Marty Makary, to your point, has trafficked in outright misinformation. He's been proven wrong. He speaks confidently, but he's been proven wrong. He says that, as an example, this is a common talking point on the right, that COVID vaccines actually cause myocarditis, inflammation of the heart, and that infection itself poses less of a risk. Several studies, Alex, have actually debunked that main talking point. He's just also, broadly speaking, just not qualified. I mean, he is an author and he's a clinician. He is not somebody who has been at all close to medical compliance, regulatory compliance, policymaking on drugs or food safety. He doesn't have any type of bureaucratic or government experience when it comes to managing a sprawling organization. So he lacks management skills, and he doesn't even have basic skills when it comes to understanding medical, legal, compliance law when it comes to these critical initiatives. And so suddenly he's going to be placed into replacing Dr. Rob Califf, who's done several stints at the FDA prior to being commissioner now. He just doesn't have the fundamental background to be in that position. And then, of course, there's Oz, which we can go on and on about.
Yeah, well, let's just table Oz for a second. I mean, Makary's overseeing the FDA's $7 billion budget. And I wonder what you think, for example, the future is for vaccines and vaccine distribution and development, given the fact that you have someone who could be HHS secretary, who's an avowed vaccine skeptic, who does not think there are any good vaccines out there, and Makary, who's a vaccine skeptic and who mistakenly believes things about natural immunity being better than vaccines. I mean, is there a real world effect that we are barreling towards having these two individuals potentially in these roles, these important roles when it comes to America's health?
Well, clearly we're seeing with the CDC. The CDC can or cannot recommend, Alex, what vaccines we do or do not put on, or that kids, for example, should be getting. So they have a critical thought leadership role in terms of recommending at the state and local level what we should be doing. So they can, on day one, start to revise that. So the CDC director, by all accounts, is going to follow RFK Jr.'s edict. Every single one of these appointees has been, as my understanding, has been floated by him and is copacetic with his approach. And so Makary, as you've already pointed out, is going to bend the knee exactly to RFK Jr.'s preferences. And so it is going to have a real impact on what the FDA is going to say, what they're going to approve, perhaps how they're going to approve it, how they're going to talk about potential side effects. You know, is it going to be balanced information? RFK Jr. Talks about presenting safety information, Alex, on vaccines. By the way, we've been doing that. We've been doing that since a 1986 law mandated it across the country. So he's also introducing skepticism on things that we in green scrubs or in white coats or in an actual hospital have been doing for decades. So that's the concern here, creating skepticism where there should be trust.